Hello, everyone. Welcome to the Family Connections Adapt Coalition YouTube Watch Party series. Today, we have the honor to have Sara Yllescas from Hyacinth, who's going to be presenting about the organization and the work that they do in the community. Next, we're going to be presenting our LGBTQ plus team. We have Senior Manager Joel Torres, and then myself, Julia Barreto. I'm the coordinator for the LGBTQ plus. And then I'm going to pass it on to my prevention specialist, Jenna.
Hello, my name is Jenna Atme. I'm a prevention specialist with ADAPT, working with the LGBTQ initiative.
Hi, everyone. My name is Isaidi Soheda, and I'm also a prevention specialist with ADAPT, also working on the LGBTQ initiatives.
Thank you, ladies. And then without further ado, I'm going to pass it on to Sara Yllescas. Sara, thank you very much for joining us tonight.
Oh, it's my pleasure. I'm excited. Looking forward. Okay, so thank you for the invite. This is quite the honor for myself as well. We worked so hard at Hyacinth into ensuring that we disseminate as much information and reach our community as best as we can. So echoing through ADAPT would be amazing for us. So in essence, we'll start this presentation. Here we go. So this is a little bit more about us. You'll get a screen where it says our mission and our purpose, and also a little bit more of details of where the locations of Hyacinth are, texting services and phone numbers should anyone come across this and would want to reach to us directly. So Hyacinth AIDS Foundation is the first and largest HIV service org in the state of New Jersey. So the mission is to help people live with HIV, to stop the spread of the epidemic, and to serve as a critical voice in the public debate surrounding HIV in New Jersey. So our board of trustees represents various sectors within the community, and this includes education, schools law, mental health services, pharmaceutical, healthcare, finance, policy, which we rely on heavily to make sure that we're also up to date with what we're referencing to clients. So amongst our many goals, we want to, as I mentioned before, reduce the transmission. I'll move on to the following. Amongst men and women of color living with HIV/AIDS, and also to improve the health outcomes of people, of men and women of color who are diagnosed with HIV. So our program, our overall organization focuses on some specific sectors. These include program of promotion, outreach, and recruitment, which is something that I in particular have been assigned to look into more. We do internet outreach, which is something new, and hopefully we'll get to talk a little bit more about that later on. We do street outreach, which is something that we do quite a lot. We go out into the community about 4 to 5 times per week. This will occur during non-traditional hours as well. So we want to make sure that we're serving everyone, and we go even after hours, so 8, 9, 10 o'clock in the night with focus groups, inputs of location and time. So we do touch base with our community members to see what are the needs of our community in terms of like, when are things happening? When will we get the most receptivity for our services? Next, besides program promotion, we do look into diagnosing our patients. This initiative will identify, we recruit people, we engage HIV positive African-American adults who have high probability of acquiring HIV/AIDS because of risky behaviors, but we provide easy access to HIV screening and testing. So we do this through mobile units as well, and community venues. So we do have events, peer promotion and social marketing, which means obviously, as I mentioned before, we try our best to address what the needs may be. And so we go out and we collaborate with community leaders, whether it's church groups or whether it's any other group of community service that can share with us some events that they're doing, and then we jump on the bandwagon and we take the mobile unit with us. So we also do referral and navigation services, which means that if we are to test people on field, and when we do, if they test positive, we bring them back, and we do have a whole clinic in affiliation with us. So we're able to connect them with a physician to follow up with medication. We're able to connect them with housing services as well. And anything related to policy, for example, that can protect them or they can use this tool, we also offer in-house. So we do have the verification program that we follow, which is of New Jersey, which most entities who are dealing with HIV cases do have as well. And Hyacinth has, procedures in place, right, to link newly diagnosed and out of care patients into medical care, because now the state also wants to make sure that they are serving these clients as best as possible. So getting them to the right services, linking them to the right services and the right entities is extremely important. Very well. So what we also do besides linkage to medical care for our patients is re-engage them to HIV medical services. We do this by identifying previously diagnosed but out of care patients, and we set them up with appointments with their recent medical providers. So we also do medication adherence, which is extremely important. We also talk about with them the different kind of options that they have with medications. There is a new vaccine that has come out, or rather injection for HIV. And so we try, I guess what I'm trying to hint at is that we try to provide as many tools and as much information to our patients so that they can feel empowered to make healthier choices for themselves. So go to the slide. Why do we focus on Newark in the first place, right? I mean, it's quite a privilege to do so. There are many opportunities for community engagement efforts, but Newark also ranks number 8 amongst the top 10 states in the US for new HIV infections. So in New Jersey, persons of color are those most burdened by the epidemic. So they account for about 81% of new cases of diagnosis. We go into the prevalence rate being 17.6 times higher for African-American women compared to white women, and 8 times higher for African-American men when compared to white men. So transmission through heterosexual sex accounts for more cases now than at the beginning of the epidemic. Heterosexual contact is the leading risk of exposure reported by people living with HIV/AIDS. And the target population for us is 40%, 42% in Newark, 55% in Irvington, 45% in East Orange. So we do try to amplify our efforts to as much as possible in Essex County. So the Newark Metropolitan Statistical Area of Essex County, I'll just mention this briefly, responds to about 9,658 cases of HIV. Those most at risk of poor health outcomes are Black and African Americans, to reiterate just the population that we serve and why it's so highly needed to serve them. So, pardon me. So African Americans, as we just continue, one of our main targets to help, are more likely to test late as well, and if tested positive, are less likely to enroll in care and treatment. And as a prevention team, we certainly look into why this takes place right in our community. Later on, we'll mention some of the YouTube opportunities that we're trying to come up with, and this, one of them in particular, hints at speaking to our community in a way where we're opening discussions about what things mean to them in terms of sex or sex education or heterosexual contact, things like that, or gender identity. And we feel that it would be extremely important for our service delivery to get the pulse of our community. And so when we talk about these type of programs that try to serve African-American men and women, et cetera, we want to also understand what the needs of this community are so that we can target that and we can curtail our services better to serve them that much better as well. So social, economic, and environmental factors among target populations at increased risk for HIV include high rates of poverty, right, homelessness, poor access to healthcare, high risk of incarceration, and concurrent risk for sexual transmitted infections. We're talking about viral hepatitis, which we also test here, and TB, which we also test as well when we go in with the mobile unit. So efforts to reduce HIV must bring HIV education. I'm sure you guys are very well aware of how imperative that is. We also provide testing, right? We also have to give them supportive services, especially to those at greater risk of undiagnosed or untreated HIV, in a way that requires them to prioritize something that they're not immediately experiencing, which I think is extremely important. How do you know what you don't know? So that's our take when it comes to our approach as well. As the number of undiagnosed HIV persons is reduced and the number of of individuals that are virally suppressed is increased, incidence rates, right, will be reduced, and morbidity and mortality will decline. And that would essentially be our echoing mantra. We want these rates to continue to decline with our efforts. So this underscores the urgent need to prioritize and target HIV prevention efforts in disproportionately affected communities, and provide intervention services that address these type of social determinants that put people at high risk. So our program serves the Newark community through testing, prevention care, and supportive services. And once engaged, participants are provided navigation support, as I mentioned. So just to give you guys more of a specifics about how it works, we go on into the community with the mobile test unit. These collaborations are harbored previously. We talk to individuals about what their missions are, if they align with ours. We coincide with the date and time. They let us know approximately, how many people we're expecting. We go out, we provide not just the mobile testing unit, but incentives for reading information, t-shirts, keychains, that sort of thing, to continue to have the Hyacinth name be promulgated within communities. And we offer them testing. Once we do this, we also give them sexual education while there. We extract information about their daily lives and about some of their behaviors. And as they get tested, we are offering this input. At the end of this input, we're able to get what the results are. And after whatever the results may be, we continue services. We check in with them, should they need anything, whether positive or negative. And then if negative, just continuing harboring this united family with Hyacinth, and making sure that if they are high risk, also making sure that they come here for example, condoms, or if we are to give sexual education classes, that they can come in and they can step in for those as well. So once again, and the reason as to why we continue our services is our purpose to reduce the rates of HIV transmission and acquisition. So just to reiterate once again, or what our mission may be, what we do, but what we do, the purpose of our initiatives is to reduce the rates, right, of HIV transmission, with the overarching objectives to increase the number of the target population members who are aware of their HIV status, and to increase the number of newly diagnosed and previously diagnosed but out of care HIV people who receive adherence, prevention, and other essential services to ensure successful linkage. So we also want to increase the number of high-risk HIV negative people with the target population who are referred and who have access to PrEP. And that's the PrEP counselor does go out with us in the mobile testing units. This gives them the opportunity to speak to the community, specifically those who are at high risk, but who also may not test or qualify for HIV positive services. And as you guys may also be aware, it's a program that is being amply offered to women as well now. Slide. What kind of programs do we do? This is the exciting part, because our mission is set in stone. And so how do we innovate as so many social parameters begin to change? And one of the newly programs that we have, and you see some statistics also on the PowerPoint, is the at-home testing units. What the purpose of this particular project is to give the opportunity for women who perhaps are not able to come into our offices and who seek more privacy to test at the privacy of their own home. And so this is a pilot program, but we're very excited to jump on it because this is new of its kind, right? And it's also meeting the expectations of innovation. So we know that we want to get people more in service. We want to be able to offer this some sense of knowledge of if diagnosed, but we want to also do this by meeting what their demands are or their interests are. So this comes with the background that Essex County had the state's highest number of adults and adolescent women living with HIV in 2008, as well as the highest proportion of women amongst adult adolescents living with HIV/AIDS. So that in itself is a trigger to jump on something immediate. And so because, as you heard before, it's adults and adolescent women, they wanted to provide this mixture of innovation by giving them home testing units at home to have this option to test. So, pardon me. Right. So one of the main reasons why we're doing this program as well is because women report higher stigma amongst all gender of domestic violence ranked first in service that was needed but not received. So additionally, late diagnosis is more prevalent amongst Hispanic women and Black African-American women, than white women. So economic and social factors limit the target population's access to and use of healthcare. So HIV testing and screening being one of them, as well as linkage to care and adherence to treatment. So in turn, this results in increased morbidity, and mortality rates, as well as high community viral loads, which cyclically foster increased HIV incidence rates. So how will these test kits work, right? So we want the existing services to address the specific needs of women, including the ability to test HIV on their own terms. And I really like that word, in their own terms, at the time that works best for their complicated lives. And everybody has a lot going on. So this is like at your time, at your demand, including finding childcare for children. And that's one of the biggest things whenever we want to host programs that are cyclic, that they have to come into our office every week for about 6 weeks. Sometimes, even though you may say, these great incentives, they may also say whether it's transportation, but also where do I leave my children? So this allows them to test at home, comfort home provides a high level of confidentiality as well that can allow women to feel more in control of the situation. So lastly, how will marketing efforts be created for this new brand, this new project? Marketing and distribution of home health testing kits will be promulgated through online education programs and community and social engagements efforts to the target population. And they will address the specific social barriers experienced by women and lead to increased identification of HIV. So we're all talking about privacy, we're talking about flexibility, and we're talking about empowering women by demanding a testing kit to be placed in their hands at home, having to no longer come across these barriers that they would if they would have to go to seek services. So how we structure our programs is to develop social awareness campaign. And that's the exciting part, because such as this YouTube party, we're thinking about different ways that we can go into not just IG or Facebook, but other ways we can utilize our services into more creative mediums. So we also have focus groups, right, that will give us a better idea of what could be the most palpable measure, social networks and non-traditional partners as well. We are affiliating, I'll mention some of these affiliations within Newark, the Sex Workers Outreach Project at the Newark Public Library as well, the New Jersey Red Umbrella Alliance, and local faith-based organizations that specifically provide services to sex workers. So, okay, so the following program is called the Sister Program. This program has been going on for quite some time, and we've seen all arrays of success with it. This is the type of program that would go on for a few weeks, and it would be cyclic. So epidemiological profile for Essex County for New Jersey supports the federal grant for SISTA in that it reduces new infections by 75%, it's been noted, which is great. So the diagnosis pillar is very strong with the SISTA, is meant to diagnose all people with HIV as early as possible after infection. So Black and African-American women are more likely to be diagnosed right later in life, as we mentioned before. So what are the high impact prevention projects? What does it mean? And SISTA is one of them. It is with a proposed target population, which is in this case, African-American women and men, targeting 30 to 64-year-olds, specifically in Newark. And we're talking about high risk, who are obviously high risk for HIV and most likely to be HIV positive and undiagnosed or out of care. In this case, some of these include sex workers, drug users, men who have sex with men, transgender people, ex-offenders, homeless, or mentally ill individuals. You know what? I'm going to go back. I just made a mistake. Here we go. Well, to add one more note on this, SISTA has been going on, as I mentioned before, for about 20 years. It is a Hyacinth behavioral prevention services, and that it includes the evidence-based intervention program. So SISTA uses facilitators manuals, it uses videotapes, it uses the 5 activity master packets. It's called the evaluation material. So it is a very regimented program. I was a Latina health educator for a few years, way back when. And what I found most enriching about it is the opportunity for women to come together in a group and to have the space to talk about private issues that they may not be able to talk to, definitely maybe not their partners, but even their friends. And so this was very therapeutic, 6 ongoing weeks sessions where women also were able to build rapport with the other women in this particular groups. And from that, I really did feel that they gained confidence from it because they gained also a friend and someone who listened to them. So SISTA project is a social skills training intervention for African-American women. It is aimed at reducing HIV sexual risk behaviors. It's comprised of 5 to 6 2-hour sessions delivered by peer facilitator, and it's community-based setting. The facilitator had to be cultural relevant to that particular group. So in this case, we were running Latina health groups. There's also an African-American group. And so what we wanted to see is having that cultural connection to be able to really hone in with the topics that were being spoken about. So as I mentioned, cultural relevance, we talked about behavior skills, changing or practice. We had group discussions. We have lectures also for them because it is in part a big educational component. We had role playing, which I think it's always a lot of fun, prevention videos to reinforce the educational concepts that we provided, and take home exercises to reinforce as well. So some of the questions that I'll also just mention with this: how do CDC grants promote social media campaign? So funds for our particular grants or programs here at Hyacinth will be used to continue our work to identify newly and previously diagnosed individuals through social awareness campaigns to promote home testing. More and more, we're finding that it's the reliability of going through with times, connecting with how socially our demographics are changing. And so creating a bigger footprint, an online footprint for us is extremely imperative now. So our goals include increasing social media campaigns, of course, and enhancing our existing testing, prevention, care, and supportive services on site with the added component of home testing. In this case, it was one of the projects. So what happens when the hits begin to come in, right? And some of these website promotion options that we have, such as in Facebook or IG. Well, once engaged, our participants are provided navigation support through secure linkage. In some cases, we do reach out to those individuals who show curiosity. Sometimes we ask questions in our IG or Facebook page. And so we reach out to those individuals who have these questions and we ask them to come in and seek services. So that's where the linkage and retention to medical care come in. So as part of our innovation techniques, we will launch the at-home testing kits. How will this new initiative impact our current community? So we believe that home testing has been shown to be a very effective option for women who experience barriers. We mentioned some of these barriers prior, such as lack of access to healthcare, insurance, or transportation, or childcare. So the initiatives that are going online or that are using more of a remote approach will create interagency collaborations in the proposed service areas, which we like. We believe that prevention should be strongly linked with care and treatment. And so most of these programs, if you're sort of picking up the terminology, it's always prevention, linkage to care. And because we have the opportunity to have everything in-house, it just facilitates that bridge that we're trying to form as well. So these ongoing online or social media resources increase the collective impacts of all initiatives and ensures the funds that are being used appropriately. So how else does Hyacinth connect with clients? We were mentioning before the different various uses of technology to follow up with clients as well. And we also use text messaging applications to reinforce them being in care. Social media platforms, of course, the Facebook, the Instagram. We're always trying to innovate as much as possible, whether it's going live, but we also have to be conscious of using the right times, right? When we see most activity. So it's been a progressive understanding of when the community is mostly active and how do we frame what we're trying to educate them on, which is in this case, we're out there testing, but how do you frame that in a way that it becomes really interesting and you have more and more people coming to request this testing from you or to like meet you at that place. And so we always have individuals within the community, so our CAB, who tell us, well, this is, a better time, or this is how you should frame it, this is how you should say things. And this is a way that we progressively always keep a check and balances for our program. We also ask surveys to our clients after they receive service. And some of the questions is, what impacts do our virtual outreach and peer promotion activities have on testing services? What impact does our campaign and peer promotion activities have on HIV and risk reducing behavior? What kind of impact are we creating with our clients? And what impact does our campaign and peer promotion activities have on linkage? What about retention services? What about re-engagement, right? So we want to understand how to best serve our community. And lastly, to add to that is that we're also actively seeking leaders within our community. In this case, we have even some doctors, some lawyers. Some doctors come and interview with us and are part of our newsletter. And what they do is like they demystify some of the issues, not issues, but like some of the misinformation that is carried out in the communities, perhaps about COVID-19 or about vaccines, and what is really science and fact and what is myth. And they do this both in English and they do this in Spanish. We want to also make sure that we amplify our voice by promulgating to different languages. And we do have individuals, we have someone who speaks French. And so we do have Creole population within our Black community. So we certainly try to be as flexible as possible and conscientious as possible that we are offering our services to meet the expectations of as many clients as we can. So how do we create effective public health intervention programs? So Hyacinth has a long history of providing services to the target population in Essex County, as we mentioned also prior. But how do we innovate these ongoing outreach prevention efforts? So we do have palm cards and flyers that we use that we find very successful. These palm cards are versions of role model stories. These people who are interviewed are people who, for example, may be HIV positive. They come in and they tell us their story of how, just their story, and they could tell us as much or as little as they want, but most of them become very interested in wanting to have their story be told out there. So perhaps how they contracted HIV and how their life has evolved from that point on. And they tell us about their struggle and they open up about what they've been through. And they do this in effort to become a role model to those individuals who maybe are just newly being diagnosed and who are very scared about what may happen or frustrated or whatever feelings that may be associated with those initial stages. And so for us, they become role models just because of that, just because they are sharing and empowering other people through their stories. And we do, the palm cards on one side have a picture, it has their story, and on the back side, it has our information so that when people are ready, they can give us a call and they can get tested or seek services. So we do outreach activities, as we mentioned before, and all this information is shared as well with our local partners so that they can also be aware of what services we can provide and forward us some clientele. So when we go out into the communities, we don't hesitate to reach out to just about anyone. So we have a list of beauty shops, laundromats, daycare centers, right, nail shops, fitness centers. We have as many people as we can to outreach, and it doesn't have to have one shape or size. We try to be accommodating as possible. And how does our data look like? So online pre-testing or any data that does come our way from our demographics, we have a state's evaluation system that we put it in. I think it's relevant to note because we are following the standard of grant processing. What happens if our clients don't have insurance, right? So clients that are unable to access an online survey can call program staff and complete surveys over the phone, for example. Program staff will have designated cell phones for this project. So to make sure of privacy, clients would usually be asked yes or no questions. It's just to give you some more background information. And if a client responds yes to any particular question that staff members feel like should be translated into something more concrete or serious, staff member will contact clients who establish appointment and we'll bring them in and we'll start to get them services. So how is counseling done post-COVID times? I think it's very important, right? The nature of it. Thankfully, things are changing once again. So more and more doors are opening, but the counseling can occur while the client is on the phone, through Zoom. Staff will explore which option will work best for the clients as it relates to receiving pre-counseling services. And once the pre-survey is complete and potential appointment has been made, they can establish a pre-test counseling session and begin to once again assemble for our client. The program management. So we do have several points of in-house check and balances. We have bi-weekly meetings just to give you some more insight or a little bit of insight of what happens in Hyacinth and how we not just provide these programs, but also make sure that with, inside of our departments, we are keeping tabulations as best as possible. We are very highly active in many HIV planning groups. This gives us a more decisive voice in our community. So if we start seeing changes in the community that we serve that we believe would be relevant and important to bring about in these important meetings, we do so. And being able to sit in these planning group meetings as voting members, I think it definitely facilitates the opportunity to create even bigger change. So how are programs managed and how do they reflect our current population, right? The performance data will be used to adjust project activities. And I truly believe that this is one of the most important aspects of what we do, which is being very reactive and proactive about our work and about going out, not just going out into the community and not always just being versatile, but it's also how do you integrate this and continue to better and better our services. And we see that there is continuous increase of clients being tested and clients coming and seeking services. Our goal is definitely not to go out there and find as many positives, but to connect individuals as much as or streamline as best to the services that they need immediately. Whether it's even mental health that we come across on fields. We do have an individual who takes care of mental health services, so we do mention that, as well as housing. So focus groups is another important point of program management. This will be at the beginning usually of our programs, and they will cyclically come into place so that we can touch base as to what kind of changes we should consider for our program. This is a very fun one because this is one of the reasons why we're here today speaking about Hyacinth of collaborations. So when we partner up with non-traditional agencies. So this means that we also partner up with the Newark Police Department. If we are, I will take liberty in saying that we are very successful at what we do because we go on into the community with the reinforcements of cops. It, I believe, really tackles just recent incidents, George Floyd, correct, where there was a lot of anger that was just trickling around into the communities between civilians and cops. And so it's extremely important to be able to get rid of that, dismantle that within the community when we go out, when they see health services or when they see community outreach workers align with African-American or aligned with cops, pardon me, then I do believe that it forms this sort of unison that allows other people to reflect and to feel a lot more at ease. And progressively, it's our goal to also continue with this effort so that we dismantle any inhibition from the population towards cops and work and that sort of force. So yes, and so what they do is that they facilitate for us as well, going out into the community and doing so successfully, because safety is our main priority with our team. It's a team of 4 ladies, and if I mention them, they're absolutely wonderful. They're the go-getter personalities. They've been doing this for quite some time, this meaning outreach and also doing program promotion, and so they know exactly how to say things, when to say things. They are very reactive and listen very well to their community needs, and so they're able to immediately change the discourse of what they're saying to be more effective. So to have these powerhouses go out on their own, it would not really be feasible, especially if they're covering so much ground. And so having the police with us really does amplify that opportunity for us, because then we have absolutely no fear in being able to help as many people as we can. So to throw out some more statistics, because they are, I suppose, relevant. An estimated 1.2 million people in the United States have HIV, including about 161,800 people who are unaware of their status. So nearly 40% of new HIV infections are transmitted by people who don't know that they have the virus. For people with undiagnosed HIV, testing is a first step in maintaining a healthy life and preventing HIV transmission. So people who get tested and learn that they don't have HIV can also make decisions about sex, drug use, and healthcare that can protect them from HIV. For people at risk for HIV, taking HIV medicine called pre-exposure prophylaxis, this is very highly effective for preventing HIV, right? So we, in the mobile testing unit, and you see a version of a mobile testing unit there, we do a test, it's called the antibody test, and it looks for HIV antibodies and antigens. This is gives you about 18 to 45 day after exposure window. Then we do another one, it's called antibody test that looks for antibodies of HIV in your blood or oral fluid. Antibody for this is like about 23 to 90 days to detect the HIV infection after exposure. So we do these two, and we are able to give this information to the clients who test with us. So what happens if somebody tests on field with HIV, they get a client ID immediately. They will develop a file for them immediately. We will gather all their paperwork, and then we immediately set up an appointment. We confirm that their phone number and their address is correct quite a few times, and we ask them to step into our office as soon as possible, if not that very same day. Right. And I believe that that's essentially it. So I don't know if you guys have any particular questions at this point, but I'll be more than happy to respond to these.
All right, thank you, Sarah, for a great presentation. Now we're gonna move on to the question and answer session that we have for you. We have a few questions, so I'm gonna pass it on to my team to just start with the questions.
Okay, so Sarah, my first question for you is, how do most of your clients hear about you and the work that you do?
Thank you, Jenna. Yes, I want to say that word of mouth certainly is high up there. We have quite the repertoire of clients that have seek services, whether it's HIV positive or HIV negative individuals. But we also go into the community quite a lot. So as I mentioned, 4 or 5 times per week. And so they're seeing the testing van right and left. They're questioning us like, what is it about? And so they hear about us, whether our presence in the community because it's so active or because of the clientele that we've established that have recommended us to them.
Awesome. So my second question that I have for you is, when you are doing your street outreach, how do you get clients engaged into having a conversation?
Absolutely. That's a great question. So usually when they see the mobile unit, it's easier for them to come in and to get tested. And while there, then we're able to get them sort of engaged into disclosing more private information that could help us more into what would be like healthier health decisions. But if it's just out in the community and doing tabling, really the personality of the team is quite interactive. And so they'll get up and then they'll start moving around. They'll just start asking people who are walking around, hi, good morning. Did you hear about us? Well, this is what we do. And tell me a little bit about yourself. And so to say that we're as engaging as possible, it's, an understatement. We are. And we have giveaways. So that's always something very captivating to people. They want to know, what is that about? Or can I get one of those? And so how do we get clients to engage into conversation? Just actively presenting ourselves, engaging, directly seeing someone coming and going up to them and just friendly face, friendly smile. Here, this is us. How can we help you?
Our next question is, how many clients do you screen on a monthly basis?
Absolutely. So we're looking at about 90 to 100 people, if not probably a little bit more per month on the testing mobile unit. We're also, if for some reason we cannot test them on field, and we ask them to come to our clinic and set up an appointment with us, and they have done that. So it's a combination of both, mostly testing on field, but also testing in office here.
And lastly, besides Essex County, what other counties does Hyacinth serve?
Absolutely. So obviously we're focused here in Essex, but we also have offices in Trenton. We also have offices in Patterson, in Jersey City. So we're all throughout New Jersey, and that's great to say, because should anything change with our clients, then we could always offer them support in one of our centers.
Let's pick up on Park 1 next.
Perfect. Thank you, Sara. Thank you for great presentation. And thank you for the people that are actually watching this YouTube watch party series that we have. Please stay connected to all our social media accounts. We have Facebook, Twitter, Instagram, and YouTube. We're gonna continue with the chat room. If there's any questions, we will be ready to answer those.